The following COVID-19 vaccine hesitancy segment is presented by Holy Cross Health, the Community Health and Wellbeing Department in Fort Lauderdale. For the very first segment, we would like to introduce Dr. GORENSEK. Did I pronounce that correctly?
GORENSEK.
There you go. And I am your host, DJ JimmyP. JimmyP Perigny is how I'm known in the HIV world. At any rate, welcome to Eagle Radio.
Thank you. Happy to be here.
I guess the first thing is a lot of confusion going on with COVID, because over the 2 years, it's been higher, it's been lower, and then it comes back again, blah, blah, blah. Should I get vaccinated? Should I not get vaccinated? We know all of that hesitancy. And so we want to sort of dispel some of these myths if we can, all right? Actually, vaccinations, it starts here. It starts with you. Protect yourself and your loved ones from COVID-19. And we're going to go over all of that in a few minutes. But in the face of all this changing, why should people trust public health officials with guidance that has been unclear from the CDC? And why has it been unclear?
Well, I think you have to remember that COVID is a totally new virus when it came out in 2019. So it was unknown to health officials exactly how it would act. We were learning as we go along. We knew that it was a virus for which humans had not been exposed, so that made them at risk for being very sick from it. And we know in the early days, a lot of people are dying from this virus when it first came out in China and subsequently came here. So there was a lot of fear about try and protect the public. And the first goal they had was to try and come up with a vaccine.
Right.
Because we know vaccines can help prevent the disease, at least if not completely prevent people from getting it, at least decrease how sick they get from the
And that took about a year to develop, roughly, right?
Yeah, but it's amazing how fast the vaccine was developed, and that's because the technology had already, the research for the type of vaccines that came out, the messenger RNA vaccines, had already been going on since 2005. It wasn't like this all happened all at once. They had been working on this type of technology, and actually it had vaccine for the MERS virus, which is a similar virus to the COVID, a few years ago, but the vaccine never got past phase 2 because the cases died down. It didn't become a global pandemic like COVID has become, but they had the technology, so they were able to get things moving quickly with the help of the government funding the research trials, because in order to get a vaccine approved, it goes through 3 stages. The first 2 already have been done with the prior vaccine they were working on. So the third phase, which is the most important, is when they have to have tens of thousands of people in a trial to see if the vaccine really works. And this is why we were able to get it done so quickly, because the government paid for the phase 3 trials, which involve like up to 40, 60,000 patients in some of these trials. So we had enough data to definitely see that the vaccine definitely improves survival significantly by over 95%.
Right. So each clinical trial gets bigger and bigger and bigger.
Well, the phase 3 requires a certain number of patients to be able to make a valid conclusion statistically that the vaccine worked. So for instance, in the 3 different, the Pfizer, Moderna, and the Johnson & Johnson, and one of them was 40,000 people worldwide. One had around 30,000 and the other one had around 60,000. So because the government paid for the research, they were able to get these trials done quickly. Normally it takes
years. And they were competing.
Yeah, and normally it takes years to get enough people in these trials for vaccines. So vaccines normally take several years because it takes that much time to get tens of thousands of people.
Right, because I remember the HIV medicine trials were forever and a day.
Yeah, that's a different area, but for vaccine trials, the key thing was to get enough people in the trials to be able to see that the vaccine worked.
Right.
And so it became very apparent as they came at it through the trial that the vaccines were very effective in preventing COVID, over 95% effective in the Moderna and the Pfizer.
Right.
So that's part. So I think we have to be very grateful that these vaccines got developed in such a quick manner that they were available already by the end of 2020.
Let's talk about face masks and what role they played in containing the virus itself. First of all, what type of face mask should people actually be using?
Well, I mean, there's different types of face masks, and the goal of the face mask is to prevent people from spreading virus because they're covering their nose and their mouth. For healthcare workers, the face masks have to be designed to protect the healthcare worker from getting virus from the patients they're taking
Right.
care of. So those are the N95s, which we use when we.
That's the N95.
That's the N95. That is not necessary for people in the general public to be wearing. The N95 is for when you go into a room with a patient with COVID or TB to protect the healthcare worker from inhaling.
And what about the KN95?
Those are fairly good too. They're in between an N95 and a regular surgical face mask, which have several layers to protect.
Right.
So the goal of face masks is to prevent transmission of people who are having symptoms.
Right. At its height, I was driving around Fort Lauderdale trying to find 95 masks, which forget it. It's like trying to win the lottery. But there were KN95, so I said, well, someplace better than nothing.
Yeah, no, they're all good. I mean, the goal of the face mask was to decrease transmission, and there are studies that support that. They're not 100%. It also depends how you wear it. If you see people wearing a face mask under their nose or on their chin, it's not going to help.
Right.
Yeah, but the goal is really just to keep people from spreading it. So it's very important for people who have symptoms to wear a face mask if they have to go out among other people.
Correct.
So they have a role, but it's not the end all and the be all. It has to be balanced with moderation.
Testing. Let's talk about testing. I know that you can order free at-home kits now through the CDC, has a special website through, I think the post office actually runs that, because I got 2 free kits, which each have 2 or 4 in each kit, I believe it is.
There's 2 in each kit or 4.
Yeah, that's what it
I think
is.
they're different too, depending.
So,
You can also buy them as well. They're available.
Right. So actually, this at-home testing is actually helping a lot with the height of it, actually, right away also.
That's a relatively new addition. It's helpful for people if they have symptoms to test themselves. It doesn't pick up people that are asymptomatic, and it may miss people early on in infection, whereas the PCR is the most sensitive test. But they're useful in the family. If somebody gets symptoms, you test it. If it's positive, you know to isolate and keep yourself from family.
And especially in the winter when we have influenza virus going around, so people are like freaking out. Do I have pneumonia? Oh, I hope I do, instead of COVID, right?
We actually are seeing this year, resurgent influenza. For 2 years, we really weren't seeing any influenza cases at all. And that's because with the pandemic, when it started, everybody was isolating, everybody was wearing masks. So I didn't see a case of flu in those 2 years. Now, though, because of the loosening of the masks and people are out there and, things have been freed up and you can only stay isolated so much. And we have the vaccines where most people have received at least one or both vaccines and some the booster. With the loosening of the mask restrictions, we are now seeing the other viruses coming back. So we're seeing patients now with both COVID, influenza. I have several in the hospital with that. And we're seeing among the kids, a lot of the respiratory viruses coming back, entro, adeno, because people are out there, not wearing masks.
So should people actually get a seasonal flu shot?
That's absolutely been recommended for years by the CDC. Influenza is probably, it's in many ways even worse than COVID, the strains that are now not as bad. But the flu shot is recommended to keep you from dying from influenza. The older you get, benefit is really to keep you from getting really sick and dying. It may not completely prevent you from getting it. But
one of the questions that I get is it all right to get both at the same time, or should there be like a 1 month between the vaccines, or does it not matter?
You can get them both at the same time.
It doesn't matter.
I think initially when the COVID vaccines first came out, the CDC wanted to monitor adverse effects and side effects very carefully. That's why they suggested not getting other vaccines at the same time, so they could tell if you had a reaction to COVID that it was to the COVID vaccine that it was.
I see.
But it doesn't matter now. People are getting them both at the same time.
I understand that shortly the FDA is going to approve a vaccine that is geared to 5-year-olds. Should this be part of the general inoculations that kids get that are required to go to school?
Well, I think the American Academy of Pediatrics has recommended the COVID vaccines for kids. I certainly recommend it. Even though children don't get as sick, generally they don't get as frequently as sick. There are cases of severe COVID in children and deaths even in children over the past couple of years. And the vaccine's safety profile is very reassuring. So I definitely would recommend it. As far as making it mandatory, I don't know that that's going to be done, but recommend it certainly.
Obviously, we're still getting cases of COVID. Are people still dying from it?
Well, I mean, the virus has gone through several variants. The viruses they're generally sloppy in the way they replicate, and they make mistakes. And as they make mistakes, those mistakes that make the virus stronger or more resistant to some of the treatments and vaccines that we've developed allow the variant viruses to become the predominant virus. So right now we're seeing the Omicron strains. It tends to be not as serious a disease. The people that come in with Omicron are generally not as sick, but we still have had a few deaths, and that is, again, in the people who are most vulnerable, older people, people who have other medical problems who haven't been vaccinated. If you're vaccinated, although you might still get Omicron, a lot of people are, you don't get as sick from it. You're out for a few days like the flu, but it certainly still prevents people from dying and getting seriously ill from it. So it's definitely worth getting.
I know when it first started, the big outbreak, a lot of seniors were really passing away from it. Is there a particular reason for that?
Well, older people have the most serious risk for any illness, because of their age, their comorbidities. They have.
Is that because the blood cells can't fight back, or?
Well, just as you get older, your immune system gets weaker, and older people are always more at risk for any kind of.
So I have a lot to look forward to.
That's why the first cases we saw were in the nursing home residents. I remember when it first started our hospital, we had the first COVID patient was from one of the nursing homes in the area. And that same weekend, we had several more patients over the course of the weekend come in from that same area. And that was our first cluster of COVID cases. Most of those died. In fact, I think all of them died. The very first COVID that we had, when it first hit here, was a very serious disease. Remember, we had no vaccines, no real drugs to use at the time, and people were dying,
Right.
As time went on, we had the remdesivir. We were giving convalescent plasma, which is people who recover donate their blood. The blood bank takes the antibodies out of the blood processes, and we give them. So we were doing that. Then the remdesivir became more available, which is the IV drug that fights COVID. The steroids, it became clear from studies out of England that if you give dexamethasone to people with COVID, it significantly improves their outcomes. So we learned, as we went along, so we were able to manage people better, but we've had several waves since then. And the worst was last summer when we had the Delta wave.
Right.
That's when we saw a lot of people coming in their 40s, 50s, 60s, because the older people have been vaccinated by then. We didn't see the older age group that much, but what we saw were the younger people who still had illnesses like diabetes, overweight, obesity, heart disease, hypertension, who weren't vaccinated, and they were really sick, and we had a lot of deaths last summer. It was the worst summer because the whole hallway in our hospital where the COVID floor was, patients in every room were on a lot of oxygen, requiring significant support to breathe, and a lot of them died despite everything we did.
Well, you'll be happy to know that Eagle Radio and me actually was helping Joey Wynn with the COVID clinic.
Good.
Over at Holy Cross, and trying to spread out that information, distributed it out. We got a lot of people in there right away, actually.
And Holy Cross was really great.
They were really good about that. Joey ran a good program.
The community.
And yours truly got my first two. Thank you, Joey Wynn.
I remember people calling me, and I had called Kim, and we'd get him in to get the vaccines because people were desperate. But I think it was harder for the hospital personnel taking care of patients last summer, because we saw these patients coming in sick and dying, and we couldn't do anything. And we kept thinking if they'd only gotten vaccinated, they wouldn't be this sick. And that was really hard because the first wave, we knew there was not much we could do.
Right.
But knowing that this could have been prevented was really heartbreaking. And I'll never forget, it was a 55-year-old gentleman I took care of. And when he came in, he was already requiring a non-rebreather, a lot of oxygen. And I said to him, "It's part of the history. Were you vaccinated?" And he said, "No." And I said, "Why?" He goes, "I guess I'm stupid. Can I get it now?" I said, "Well, it's not going to help now." And despite everything we did, he died. And before he died, he told his son on the phone they were going to intubate him, And he said, "Don't be stupid like me, get vaccinated."
It was a tough time for everyone.
It was so stressful because there was a lot of underlying current of resentment and anger, thinking, why didn't you get the vaccine? It's there, it's available. And that's why I'm so passionate about trying to talk to people, because the vaccine hesitancy that's out there is based a lot on myths and false information.
False information.
the whole big thing about the infertility, there's absolutely no basis for it, but it's been propagated out there that the vaccine causes women to become infertile. There's no basis for it in any of the studies. There's no pathophysiologic reason why it would, but it was propagated by some very strong anti-vaccine people. It started in Europe and it's spread all over.
Right. Some of the other treatments that were bloviated by our former president, like what like that monoclonal thing, does that actually
No,
help?
monoclonal antibodies are very helpful. We have them. I mean, they've gone through several stages of evolution, but they are antibodies that are designed to fight the spike protein of the virus. So they work best early in illness to prevent the virus from spreading and getting into the body and causing severe disease. They are about 80% effective if given within the first 10 days of
Oh,
illness
really?
to prevent hospitalization and death. So that is something that we're still using today. And patients who either have a reaction to the vaccine, can't get the vaccine, or patients who have cancer and other immune suppressive illnesses, they're candidates for the monoclonal antibodies preventatively, or if they get illness to get them. So they definitely, so you remember in the beginning, we were trying to do all we could to help people. We didn't have much available.
Right.
So there was a lot of data for the
Now you have more tools.
hydroxychloroquine, for ivermectin, and there's places in the world that are still using these drugs. And the studies, that they had, some of them have nothing else to do, so they're still using it.
So now I'm understanding that I'm hearing around that if you test yourself at home and you test positive, run and try to get Plovaxin. Is that
Paxlovid. Yeah, there's a drug that came out just a few months
by
ago.
Pfizer,
Getting it
correct?
this year. Yeah.
And where would they go for that?
Well, it's still under emergency use authorization. So all you need is a physician to write a script for the pharmacy. And if they have access to it, not all the pharmacies carry it, but
Right.
certain ones in certain.
Like I know there's specialty pharmacies like Walgreens has.
There's certain Walgreens, certain CVSs have it, and it's given for free because it's still under emergency use authorization. You don't have to pay for it.
Because I know President
scripts for that.
Biden is trying to get more funding because I guess it's running out soon.
Well, they have to get the production up because there's such a demand for it. So that is the best one of the oral drugs that are out there. It's 3 pills twice a day for 5 days with food. Now, some physicians are hesitant to prescribe it because you have to be careful of drug interactions, especially if people are on heart meds or blood things.
Right.
You have to be aware, or medicines for cholesterol. So you have to adjust medications during the 5 days you're taking the drug. But I'm telling you, I've written for a lot of it. And people tell me within a day of starting it, they're already feeling better. So definitely, that's 90% actually effective in decreasing severity of illness.
One of the strange things that people in general don't understand is how does the virus change it into a different variant of that same virus? People don't understand how does that happen?
It's hard to explain if you're not a medical person, but trying to think of it like Darwin's theory of evolution, the survival of the fittest. So viruses replicate very fast in general. That's a characteristic of viruses. And when they do, they're sloppy and they make mistakes in the way they replicate. And so those mistakes that give the virus the ability to outwit, like the drugs that we have, or again, some of the newer variants, the vaccines are not as effective. You need more antibodies to fight the virus. So that's how they evolve, and then they become, as they mutate, they select for different variants that survive better, and that's just the way viruses work. Influenza viruses, for instance, a different virus, but they're changing every year the proteins that they have on their outer surfaces, and that's why every year we need a flu vaccine that's different to figure out which strains are the ones that are kind of circulating in the world now.
So right now it's the Omicron that's sort of fading out, right?
The Omicron variants are the ones that are here and now, but they've gone through several stages. There was the original one, then there was the 2. Now there's 2 others that are in Europe and have come to this country already. They generally have become more infectious and more easily transmitted than the original COVID viruses, but they tend to cause less severe disease. So what we're seeing now in the patients that come into the hospital, they're not as sick. They don't have the classic loss of sense of taste or smell, but they have, a lot of them have sore throat, sinus congestion, a lot of congestion, cough, fever, but they don't get sick for as long as with the original strains, and the Delta was the really bad one. So the viruses are constantly changing. We have to keep up with them, and that's why I think they're working on getting the vaccine, adding another component to the vaccine that will specifically target the Omicron variant, in addition to the original vaccine.
So do you think that the COVID-19 in its various forms, is this going to end up being like the flu where you should get a booster every year?
It looks more and more like it's becoming an endemic virus. So eventually settle into something that we have to coexist with, like all the other coronaviruses that are out there, the multiple cold viruses, the enteroviruses is probably going to fade into the background. The key will be to get immunized, especially if you're in the higher risk groups, older people with, medical conditions like diabetes, high blood pressure, heart disease, and the like, cancer patients. So I think we're going to have to learn to live with it, and that's probably where it's all going to end.
Right.
But it's constantly, we're learning as we're going along.
We're learning as we go along. Let me ask this really stupid question. So now we have Omicron. So does that mean that the original COVID-19 is not around?
They're being replaced. I mean, it sort of changes, right? The virus is sort of changes and evolving as it goes along. So
and the other one's dying out.
Yeah, right. It's being replaced because remember, the original vaccines all worked really well against the original strain that we were seeing. So the vaccines now they're not as effective as at the Omicron, but if you get the reason for the booster that was recommended, knowing that we had these Omicron variants, was you get the antibody levels up high enough, it'll still be able to fight the Omicron so you don't get as sick. It can't completely prevent you from getting it generally, but you won't get as sick and your risk of dying is significantly decreased still.
If you haven't been vaccinated or you have been vaccinated, but you need a booster and you need a second booster, or if you're traveling, please call Holy Cross hotline, which is 954-542-1654, and make an appointment to go over to receive your COVID vaccine.
See, what's happened is the vaccines are available now at all the pharmacies, so that it's easier for people to get.
Oh, that's true. Yeah. That's correct.
But we do encourage everybody to get a booster. I tell them with patients, if it's been more than 5-6 months from your second dose, get a booster. And if it's been more than 5-6 months from your booster, and you're in a risk group like a healthcare worker, older person, people with chronic medical problems, get the second booster. I've already had mine.
Which I already had. I was waiting for number 3.
But the first to get it, yeah. No, but I think it's very important for people to understand that there's a lot of misinformation out there that is being propagated, and it's very hard to talk to people and they have it in their minds that these vaccines are bad. I have patients tell me, I don't want to get, they don't even want to discuss it. They're not even open to me explaining to them that the vaccine safety is very, very solid, that the data is very strong. Yes, the vaccines were developed quickly, but the research behind them took years. We wouldn't have been able to do it if they didn't have all that research that had gone into this particular type of vaccine, which is a new type of vaccine, but very effective and very easy to make. It's going to revolutionize all the vaccines in the future. We'll probably be using that methodology.
What role does the healthcare professionals play in this effort?
Oh, to educate people about their vaccines, yeah. So, I'm very passionate about this. Every patient that comes into my office that hasn't been vaccinated, we have a discussion about it. Sometimes they get really upset with me and I have to back off. But it's important. I try to tell them that the vaccines that have been developed are very safe, very effective, and we're very lucky we have, and they have significantly decreased the impact this disease would have had on our community if we hadn't had the vaccines. We'd have a lot more dead people, a lot more.
Well, yeah, I don't understand why people are still refusing to get that when we know we had about 1 million people pass, correct? So I don't understand why people won't do this.
It's unfortunate that there's,
It must be really frustrating.
Especially when I sit with a patient who's trying to tell me that the vaccines are no good and that it's a government plot, and I'm going, I took an oath as a doctor to do no harm, and I'm here trying to tell you this vaccine is important for you to get. We saw a 29-year-old girl die this summer who had a risk factor. She was overweight, and it was heartbreaking. And
these vaccines have proven safe.
Yes.
And so I still don't understand why people are resisting it.
And the amount of effort that has been made to continue to collect data on these vaccines, there are multiple programs in place. Some already were set by the CDC to follow vaccines, all vaccines. but a program specifically designed to follow anybody who got the COVID vaccine to pick up adverse events, so that the commitment to safety is very, very strong. But if you look at the risk benefit, it's beyond me why somebody would choose not to get a vaccine that could save them from dying from COVID.
I mean, there's been millions and millions of people that have been saved that have been vaccinated. So they're looking at the less than 1% that maybe had a problem for some reason. It just makes no sense to me.
And it's really sad. And I think that's why the best thing we can do as physicians, keep talking to our patients and telling them, that the truth about the vaccine, the fact that the vaccine we think is very important for them to get to protect them, and hopefully start making a dent in some of that misinformation.
Correct.
I've had a few patients that did break down and get it, and I was very grateful they did.
Yeah. Well, thank you for coming by. We really appreciate you shedding light on the COVID vaccine, getting vaccinated early as much as you can, all the doses. I guess we'll be seeing every year a different booster, most likely, right?
It's looking more and more like that. Again, I don't have the crystal ball, but I think that's what we're looking at probably.
Right.
Eventually it's going to be a virus that'll be there. It'll have peaks and valleys. We'll have, but we'll be able to deal with it. We have drugs to fight it.
Right.
We have vaccines to help people from getting really sick from it. So hopefully it'll be fading in the background one of these.
Well, when booster 3 becomes available, I'll be the first one in line. Because I'm old, but I'm not going to go yet.
Absolutely, yeah.
Thank you very much for coming by Eagle Radio. We appreciate it.
My pleasure. Thank you very much.
Thank you very much.
And if you have any questions, you can always reach out to me.
Okay, thank you.